In your estimation, what is like the predominant culprit? What do you see more often?
Typically wax. Yeah.
Always wax.
It's always wax.
All
we
roads
always circle back.
lead back to wax.
Welcome to the Ask an Audiologist podcast, real audiology white papers written by real audiologists and explained to you by a real audiologist and a guy who isn't. Now here are your hosts, Dr. Jordan Strong and Kevin Ziener.
And while it's okay for us to whistle while we work, wait for it, it is not okay for our hearing aids to do the same. Coming to us from Dr. Kelly Knolhoff at Brookdale Audiology in Charlotte, North Carolina, we are going to spend today's episode determining how and why and what to do when your hearing aids start whistling. So let's just kind of start with the culprit. Why is the whistling taking place in our hearing aid in the first place?
Couple of reasons.
Jordan's like 3,000 reasons. Yeah. Kevin, do you want to dial it down a little bit?
Let's pull it back.
Okay.
Most common reasons are going to be you either have wax in your ear.
Okay.
And the sound is coming out of the hearing aid, going into the ear canal, hits the wax, and it bounces back.
No way.
Or the piece that we put in the ear could have a leak around it. So we really want that earpiece that's going in to fit kind of all the way around the ear canal.
Not the tube.
Right. But the earpiece, like the dome or the ear mold or whatever is used for your hearing aid.
And when you say a leak, like a leak of air?
Of air. So feedback, I guess we should maybe back up.
Take a back step to feedback. Okay.
Feedback, it's kind of like, when you're like in an auditorium and you're holding a microphone, you get too close to the speaker and it starts screaming. Yep. That's exactly what your hearing aid is doing.
Got it.
Because the sound is getting picked up that the hearing aid is producing. The hearing aid produces the sound. It gets picked back up by the microphone on the hearing aid and it creates a feedback loop. That's where the whistling is coming from. So like I said, it's either coming from wax, too much wax in the ear. It's bouncing back off and it's getting picked back up by the microphone.
Got it.
The sound is leaking out from around the whatever device, earpiece that you're using.
Sure.
And then the third one would be the volume. Like if you turn the volume up too loud on your hearing aid, then it can also create that leak and then the hearing aid picks itself back up.
Got it.
So if that's happening, then you probably need a different type of coupling device, like a larger dome, or you need a new ear mold made, something like that to be able to, so that doesn't leak back out.
In your estimation, what is like the predominant culprit? What do you see more often?
Typically wax. Yeah.
Always wax.
It's always wax.
All
we
roads
always circle back.
lead back to wax. So usually it's the user, not user error. It's just the user contributing to the problem as opposed to the technology being the issue.
Right.
So then if I am a hearing aid user and I have my hearing aids and I've had them for 6 months or a year and I start to notice some feedback or some whistling or that, that loud high pitch, what can I do to course correct it? As we've established, and about a month ago, we said, but don't stick anything in your ears if you're trying to remove earwax. Go see a professional. What are some things that I can try to do?
One, if you think that it might be wax, you're probably going to see the wax on the end of the earpiece that you're using, and then you may say, okay, yeah, this is probably the culprit. It's probably the wax. Yeah. At that point, just go see your audiologist. Have them remove it. Better be safe than sorry. And have that wax removed if that's what's going on.
Sure.
I mean, it's unlikely that it's like the earpiece if you've had the hearing aid for some time. Our ears typically, they don't change all that much.
Right.
Unless you've had that ear mold for a really long time, something like that, then maybe it's the ear mold. But if you've been properly fit with the hearing aids, then that shouldn't be a problem to start with. Like your ear's not necessarily changing. So more than likely it's something like wax that's going on, and it's an easy fix.
And if it is an actual hearing aid issue, I mean, you said, you've told me before that like warranties are anywhere between like 3 to 4 to 5 years. So if you bring it back into your provider, they diagnose it as, it's actually an issue with the hearing aid, then kind of without, I guess, getting to the logistics of it all, what are the steps taken to make sure that the hearing aid gets replaced, but that an individual doesn't have to go for like a month and a half without actually having hearing aids? How does that work?
Yeah. So if it's something, and sometimes it is something wrong with the hearing aid, something wrong with the microphone that's inside of the hearing aid, if you've dropped it or something, sometimes that can cause a feedback issue.
Sure.
So we will have to send it in for repair. If that's the case, bring it into your audiologist, let them send it off. A lot of times you can ask your audiologist for like a loaner device.
Okay.
So sometimes they can fit you with a loaner device. They can program it for you just like your other hearing aid so that you're not without while you're in that waiting period.
Got it.
Yeah.
So, one of the things that you mentioned is, if you're on stage and you have a microphone, you go close to speakers. We've all heard that.
Mm-hmm.
Is there anything that would actually happen similarly? Like I have my hearing aids in and I walk by something that'll trigger that or, I'm just trying to troubleshoot.
Someone is a big one.
Oh, okay.
Yeah. So like if you hug somebody or if you're like, I hear a lot of patients tell me I'm in my recliner at home and I turn my head too close to the recliner and then I may hear that feedback.
Oh, is it because it closes?
It's closing it in.
Interesting.
Right. So if that's the case, then we need to change out the coupling on your hearing aid or we can run a feedback test on the hearing aid.
Got it.
So in most hearing aids nowadays on prescription hearing aids, then there's a like a software inside of the hearing aid where we can run like what's called like a feedback manager, where we test the hearing aid. If you had hearing aids, then you've probably heard us run this test before, where it makes these really loud beeps and buzzing sounds.
Oh, for sure.
To where the hearing aid is testing itself, looking for those areas and those frequencies
where
feedback is likely to occur, and then it's managing that to make sure that that doesn't happen.
Sure.
So either come in and we can run that feedback manager, or we may change the tip of your hearing aid to fit more appropriately so that that doesn't happen.
As we've talked about before, most all hearing aids come with an app. Is there anything within apps that might be able to help the user? And I understand that we're talking about like dozens of apps over dozens of manufacturers. I mean, is there some troubleshooting that a patient can do via an app?
Yeah, I mean, it's a quick fix, before you can come in to see your audiologist. I would recommend if you're having feedback, if you turn the volume down just a little bit, you're less likely to have feedback because you're less likely to have the sound leak back out of the hearing aid and pick itself back up. So turn it down like a click or two, and sometimes that'll help resolve it until you can come in to see us.
And so then identifying that usually it's cerumen that's the biggest culprit. When somebody comes into a practice, how long can they expect for the cerumen removal to take place before they're able to put their hearing aids back in and be back on their way? What is a normal time frame? Completely understanding that sometimes practices get backlogged and things happen, but like for you, what's your experience with expediting that process?
Of just somebody coming in and having feedback of how to manage that. I mean, if it's something like wax, it's going to be pretty, at least in our office, it's pretty quick. We can typically get you in, see if it's wax. If it is, we can pretty quickly, get that removed, send you on your way. Yeah. We're all good. If it's something like changing out a dome, then it may be, you need to make an appointment with the audiologist or make sure that when you call in, you're telling the front desk that. Sure. So that we can schedule you appropriately. So you're not just seeing like one of the audiology assistants and you're actually seeing the audiologist to get that fixed appropriately.
Perfect. Well, to learn more about this audiology subject and really anything else you have a question about, please head on over to askanaudiologist.com. Dr. Jordan, you did a bang up job.
There we go.
We'll see you guys next week.
You can find more information at askanaudiologist.com, and you can follow us on all our social channels at Ask an Audiologist. The information provided on this podcast is for educational and entertainment purposes only and does not substitute for professional medical advice.